Okay, well, I'm getting a lot of calls lately about apitherapy. So here are some of the basic tools I use. Self-closing tweezers. You squeeze them, opens, let go, and it shuts. But it has two thin layers of the self-adhesive craft foam on the inside, so it can't shut too far. A soup container with holes in the lid. Go out at night with a red LED headlamp. Scratch at and tap on the beehive entrance. You'll get some bees to come out. When it's cooler out, it's a little easier because they're a little bit slower, and you can just scoop them with the lid into the container. A bowl of dish soapy warm water, because when the bees lose their stinger, they'll eventually, they'll die from this. So it's common practice in apitherapy to euthanize them quickly in the dish soapy water. And I usually put the bees in the fridge for about 5 minutes. They get pretty slow. Sometimes it seems to happen faster. Sometimes it takes a little longer. I'll try to do this one-handed, but as you get a bee or two I'm going to use, put her in the sink with the drain closed. Mist her with some water so they can't fly. And the trick is to grab the bee from the side between the abdomen and thorax, right there. Because then they're bent, they want to sting, and then you sting wherever you're stinging. And then I'll drop her in the dish soapy water, maybe just push her down a little quicker with the tweezers, and move on. It's helpful to mark where you want to sting, maybe with a pen, a marker, highlighter, just so you don't lose track of where the precise spot you wanted to sting was. Sometimes with arthritis or injuries, it's right where it hurts. Other protocols, it's often along the spine in the soft spots, about 1 to 2 inches from the middle of the spine. Usually you don't go above C7, cervical spine. Number 7, you stay below that typically. So you can see she is bent, ready to sting. Not sure if the camera can pick up her stinger coming out, but then I'll leave the stingers in for 5-10 minutes, get all the venom, and pull them out. Then sometimes the swelling can trap the stinger in your skin, so you don't forget about it. So 10-15 minutes max. Some people say all the venom's in there in 3 minutes, but 5-10 minutes is fine. So you should be able to find yourself a local beekeeper. Look up your county's beekeepers association. If nothing comes up, make sure it's the county of your state. If nothing comes up, look up your state beekeeper association, and they should have your local club's information. Sometimes several counties will join one organization, form one organization, and you get a hold of and try to find some local beekeepers who could supply you with some live bees to do this with, on whatever protocol you're following. Some protocols could be, you start out maybe 2 stings a week, build yourself up. A woman locally doing Lyme disease was following a protocol in Ellie Lobel's book, Venom Therapy for Lyme Disease, worked herself up, stinging her along her spine 3 times a week, 12 stings, alternating between upper and lower spine. That's kind of aggressive. Other protocols, or maybe once a week, but you want to increase your intake of vitamin C, not be on NSAIDs or anti-inflammatory medications or anti-allergy medications. Talk to your doctor, of course, and be eating healthy and getting good rest and being well hydrated, and all the other healthy things, or else this won't help out as much.